I'm just here at the Dubai Healthcare City stand, and I'm here with the Social Professor of Genomics at the Al Jalila Children's Centre. Thank you so much for taking the time for being with us today.
Thanks for the interview. So, like you mentioned, I'm the director of Al Jalila Genomics Center at Al Jalila Children's Hospital, and I'm also an associate professor of genetics at Mohammed bin Rashid University. So, being part of the academic center and the university and the children's hospital within DHCC, Dubai Healthcare City, we do a lot of work around genomic diagnostics in addition to genomics research with the university. So, and as you can see today, our main focus is in genomics. So I'm here to kind of participate in both capacities, both in the clinical diagnostics and also as part of the genomics research between the two institutions. Yeah, so I think we've been launched for over a year now after the inauguration of the center by His Highness Sheikh Mohammed bin Rashid last Arab Health. And this year we're trying to present our progress and the accomplishments that we've done in the past year. There are so many different projects that we have taken off since then. Just to name a few, we have, soon we'll be starting a screening program for lethal disorder called spinal muscular atrophy, where we will screen 6,000 Emirati newborns to see the prevalence of the disease and to identify it as early as possible so we can manage them better. So this is something we're going to announce and launch during the event. We also will launch the Center for Genomic Discovery in collaboration with Mohammed bin Rashid University, like I said, within the DHCC ecosystem. And the idea there is we see the patients at Al Jalila Children's Specialty Hospital, we try to diagnose them. Sometimes we can't diagnose them because of our lack of knowledge of the genes that might cause the disease. And so we have this Center for Genomic Discovery where we can access the data and try to find if there are any new genes local to this population that we can characterize and that we can help the patients back. A third project that we're going to be launching is a project to help very sick kids in the neonatal intensive care unit. And there we will apply a very innovative technology called rapid whole genome sequencing, where the full genome of the baby will be sequenced in a few days to look for any single mutations that might give us an idea about their disease and try to treat them and avoid any unnecessary workup, especially in the NICU setting where things can be a bit more challenging. And finally, we have another project with the Dubai Health Authority, so where we're trying to do genomic surveillance for the COVID to look for variants in Dubai and try to make sure there aren't any new resistant variants that might affect the vaccines and to keep an eye on the composition of the variants within the UK. So I think there's a lot to show. We have made a lot of progress. And we have collaborations with the academic stakeholders, with MBRU, with the government through the Dubai Health Authority, and also with the private sector doing this SMA screening for kids that might be affected with this disease. It's a great opportunity because it's the biggest event in Dubai and the region where you meet with the healthcare institutions and to actually have an in-person meeting after this long year of virtual meetings is kind of refreshing. And like I said, genomics, is very becoming the focus of so many different institutions. And I'm sure you've heard about the most recent announcement by His Highness Sheikh Mohammed bin Rashid, where he constituted the Genomics Council with different stakeholders within the UAE to oversee the Emirati Genome Project. Being here and with a focus in genomics and with all these advancements and having a face-to-face interaction with all healthcare, private and government, it's really exciting. And we're connecting with all stakeholders and we're just enjoying the event. It's really great. Arab Health 2011 is an amazing opportunity to network with the healthcare stakeholders and industry.